I'm Abby Lamp, and I am the current SLP.
I'm Monica Bangley, and I was in the previous SLP.
And I'm Renee Harper. I'm the classroom teacher.
Okay. Right. Hey, ladies. How are we doing today?
Good. How are you?
Good. So we're meeting today to talk about Alex Thomas. He's 8.5 years old, and he was referred by Ms. Stevenson.
Yes. So Alex is a student. He's in my second grade class right now, and I did refer him for an evaluation just because of some concerns with his articulation and some of his speech skills. I'm just becoming a little bit concerned that some of his speech errors that he has are adversely impacting his academic abilities.
Mm-hmm.
He's really unwilling to participate in class, and so I'm worried that this might just be negatively impacting him in the social setting.
Absolutely.
Yeah. As Alex's previous SLP, I just wanted to share some information with you. He had an unremarkable birth and has only had some speech concerns. No medical problems with his medical history reported, and no problems with his family history.
Great.
So like I mentioned, Alex is one of my second graders here at Peachtree, and prior to coming to Peachtree, his mother did tell me that he attended preschool, which is great.
Mm-hmm.
And here at Peachtree, we do administer the Georgia Performance Standard based instruction, so that's kind of like where he is academically.
Okay.
And his academic performance is really grade level appropriate. He's right on track with his peers academically, so that's great. And I don't really have any concerns about his academic performance, except for kind of that social aspect like I mentioned, which I am a bit concerned about.
Absolutely.
When I was previously working with Alex, we were working on some minimal contrast pairs and some phonemic awareness activities in some small groups. And we were using some visual cues and stimulability probes and individual therapy, and we were doing 5-minute articulation drills, and those were all used.
Great. So after analyzing some samples in his English, language arts class, math, we saw that he had a few articulation errors that also appeared in his written expression as well as in spelling.
Mm-hmm. So like I said, Alex is a great kid, and his parents, from what they tell me, they don't really report any behavior difficulties at home. And I don't really see any like outlashing behavior with him in the classroom. However, he's not really verbally engaged with either me or his peers in the classroom, and I'm not really sure if it's because he's embarrassed of his sound errors, or if there's maybe something else going on.
Yeah, he did speak very quietly and appeared anxious when responding to the teacher.
Mm-hmm.
He became very frustrated and often, gave up when answering or when asked to speak in class. He seems to know the answers to the questions, but he's just too frustrated and anxious and nervous to speak up and answer.
Right, that definitely seems like kind of what I'm noticing as well.
Absolutely.
I just wanted to add in there that Alex had a hearing and vision screen done by the school nurse, and he has all of his hearing and visual capabilities. There was no problems reported with that, and we did an informal oral mech exam on him, and everything was within normal limits. His tongue, jaw, all his articulators looked good, and we saw no problems with that.
Good. So we did a language sample with Alex, which basically we used the picture book. It has no words in it. It's called Frog, Where Are You? So we read the story to Alex with the pictures, and after we finished, we gave it back to him and asked him to retell a story himself using the same book. So he did have some strengths in there with the introduction. He was able to retell, the main characters, the time of day with the setting and stuff like that, and some of the descriptive details along with that. There was a few weaknesses. He did not recall the actual place of the story in the introduction. He was not really able to narrate the story with, direct quotations from what was read to him back. And he also omitted some names and some details regarding like the actions and the characters.
Gotcha.
We also did an articulation assessment, the Goldman-Bristow test of articulation. And we did find a few articulation errors. So with the sounds and words and sound and sentences, the normal range is between 85 and 115, and he scored an 68, for the sounds and words, and an 82 in the sounds and sentences. So this is just a little bit not within the normal range. So he demonstrated correct production of all phonemes in all positions except prevocalic R and R blends in both the initial and medial positions.
Great. Okay.
So we found that both in the sound and sentences and the sounds and words test. So these articulation errors did affect his intelligibility just a little bit, but he still had good intelligibility of about 80%. He had 8 good ratings and 2 fair ratings. So the results of the Goldman-Fristow test are consistent with the sound production errors that were noted in his language sample.
Okay, so just to kind of recap so we're all on the same page in case we need to be able to pass this information on to anyone else that's on our team for Alex. It seems like the scores we obtained today are thought to be a pretty accurate reflection of Alex's abilities from what you've said about your past work with Alex and both from what I've kind of observed with him in the classroom. So it seems like in articulation, he's demonstrating below average skills. And then on the Goldman-Fristow, I know you mentioned that his scores are very low, severe in the category of articulation, and then borderline and at risk in the category of articulation, sounds, and sentences.
Yeah, so with these results, it's indicating a speech sound disorder, particularly with articulation, and it's categorized by substitutions of the prevocalic R and R blends. And these sounds are typically mastered at about 7 years and 11 months, so he's just a little bit behind on that.
Okay. It definitely seems like those kind of errors are mirrored in his writing and his spelling too. I definitely noticed that in class.
Yeah, I observed that he was, it looked like he had anxiety, he was frustrated, he almost seemed unwilling to want to participate and answer the questions we just knew he knew in class. So
so his overall intelligibility once again is 80%, which can make it just a little bit slightly more difficult to understand him in conversational speech. But
and I mean, obviously I'm no speech therapist, but I know intelligibility obviously is really important because as I see, at least with Alex on a daily basis, when he's not understood by his peers, it makes him not be able to communicate his wants and needs as well. And then in that social setting of a classroom, he's much more unwilling to participate.
So we're going to recommend that Alex does receive speech therapy just to help his articulation, his overall intelligibility, in those social environments and at school and stuff like that. As well, I do recommend that we monitor and reevaluate in about 6 months his articulation skills as well as his story retell. So some just specific goals that I had written down, work on R and W or and sounds at the word level, about 2 out of 3 sessions hopefully. Also with prevocalic R and phoneme in the consonant vowel syllables, as well as producing prevocalic R phoneme in the initial word position, 2 out of 3 sessions with 90% as well for that one.
Great. Yep. Awesome. Well, it sounds like we kind of have an answer a little bit and a direction with which we kind of want to move, so that sounds good to me, and I guess we can meet a little bit more frequently and just kind of discuss Alex's progress as he begins his speech therapy and how that kind of transfers over to the classroom as well.
Awesome. Sounds good.
Great.
Thank you.
We'll see you ladies in a few weeks.
Okay.